Breathing and mental health. Given that 75% of people with mental health issues have dysfunctional breathing, and psychotherapy and counselling, CBT, and all of the endeavours that people normally do is not going to improve your underlying respiratory physiology. So even when you do CBT, which is excellent, you're still going to remain with a poor breathing pattern that's feeding into your stress response. And on that basis, then, it's very important to do a breathing practice, but not any old breathing practice. If you want to tell the brain that you're safe, you have to think about breathing in a way that's opposite to the stress response. How do you breathe when you get into stress? How do you breathe when you have a difficult challenge? You typically breathe faster, you breathe harder, breathe upper chest, you stop breathing, you sigh more, you're breathing through an open mouth. And all that's doing is feeding into the stress response. But if we breathe that way every day, what's our body telling the brain? Our body is telling the brain that we're under threat. And that's what's happening with many people who suffer from panic disorder, anxiety, racing mind, PTSD, even depression. So when you practice a breathing exercise, we want to tell the brain that we're safe. And it can be very, very simple. Start off nasal breathing, in and out through the nose, not in through the nose and out through the mouth. Your nose is for breathing, both in and out. During rest, in and out through your nose. During physical exercise, in and out through your nose. And even if you have to slow down a bit during your physical exercise, do just that, because you're breathing during physical exercise through the nose. It should also be comfortable. Of course, the breathing rate is going to be a bit quicker. You're going to be breathing a bit harder, but at the same time, you should feel that your breathing is under good control. Now, most importantly, during sleep, your breathing should be in and out through the nose, never to wake up with a dry mouth in the morning. So nose is the first foundation when it comes to inducing relaxation and telling the brain that we're safe. And why is that so? Well, if you think when you breathe in and out through an open mouth, how are you breathing? If I start mouth breathing now, I'm breathing faster, but I'm also breathing upper chest. Faster, upper chest breathing. What's my body telling the brain? My body is telling the brain that I'm under threat. And the brain cares for the body. The brain wants to ensure survival of the body. And the brain will do whatever it takes to get you out of that situation. It's not going to be a time for reason, thinking, or decision making. It's a time for fight or flight. Get out of the situation as quick as you can. We can't think straight because all the brain wants to do is get us out of there. So when you have a challenging situation, pay attention to your breathing. Continue breathing in and out through the nose. Bring your attention onto the breath. Breathe softer, taking a soft breath in through your nose and a relaxed and a slow and a gentle breath out through your nose. Train your breathing so you've got good recruitment of the diaphragm. And also bear in mind, if you want to improve blood flow to the brain, which can have a calming effect on the brain and reduce the excitability of the brain cells, it's not about taking full big breaths. It's not about breathing more air. Yes, there is a time to hyperventilate in a practice, in a safe setting, and that can be good for release, reset. That can be good for experiencing the symptoms of hyperventilation. But in your normal everyday breathing, improving your breathing patterns so that your breathing is light, slow and deep is also very important. So with light breathing, you can improve blood flow to the brain. This has a calming effect. With light breathing, you stimulate the vagus nerve to induce relaxation. With slow breathing, you help to dampen the stress response and increase the body's relaxation response. And with deep breathing, you do the same. So there are 3 different dimensions of breathing, and there are breathing exercises that are very simple that target each of those dimensions. This is not just to complicate it, but when you're doing a breathing practice, know what you're doing and have that breathing practice directed for you. But of course, come back to the basics. In and out through your nose, during rest, during exercise, and during sleep. Never wake up with a dry mouth in the morning.